So welcome everybody. I'm Jeff Feynman. That's Christina Chambreau. We're both holistic veterinarians practicing in Maryland and Connecticut. And we're here to help support you guys make better holistic medical decisions for your pets. And we were just before I started the recording, we were just talking about Judy's dog Lola, who just had x-rays today, and I believe, hi Susan, Susan's book signing event last week was great. So thank you for inviting us, Susan. Anyway, I don't have any more info to share about Judy and Lola's x-rays. Still waiting for Judy to reply as far as what they might have found. Just wondering who this is. Oh, Gail. Gail actually uploaded a picture. So Gail is here as well.
Oh,
Gail,
hello.
Hello.
How are you, Christina?
There she is.
How are you? Can you hear me?
Yep,
Hello, Gail.
You sound good. Yep, you sound good.
Good.
Can you hear
Excellent.
us? All right.
Yeah, sound fine.
Uh-oh. Okay. By the
We
way,
were
I love
talking
your
about
haircut
a
like that.
dog with possible ACL, Gail.
Yeah, I can't see Jeff. Jeff's not there.
Yeah.
Should I be
Who,
able
Jeff
to
or
see?
me?
No. Oh, can you? Jeff?
Oh, you don't see Jeff?
I
can see
good.
Jeff.
Can you hear
No,
me?
I get nothing.
I can
got
see.
nothing.
People-
You can't
what
see
does
him.
it say?
But you can
Jeff,
hear
sorry.
me.
All right. Well,
No,
I
I'm
am
not seeing anything. I can see you, Christina, but
I can
certainly
see
not
you, Jeff.
It just says under their connection isn't blocked by a fire. Unable to connect. You make sure your connection isn't blocked by a firewall. That's kind of weird, isn't it?
I guess I'll have to go ask Richard. But maybe he installed the firewall. Anyway.
And now,
Or maybe
now
log
you're
off and log
echoing.
on
Maybe I
again.
should sign off and then sign on again. See what happens there. Can you hear Jeff? Is he speaking?
So the people there can see all three of us. They can
Yeah.
see and hear all three of us.
Can
And I can see Jeff and Gail.
Jeff,
So
can Jeff speak so I can
so
actually see if I can hear him?
They're
Jeff,
seeing
can
you,
speak?
Gail.
I
You're there.
did and you couldn't hear me. So here we are. Nope, no luck. All right. So Christina,
I'll hang up and sign in again so we don't waste too much time.
He was talking. You couldn't hear him, Gail.
So Christina, back to Lola and ACLs. So this was the dog. When I first saw her, she had a couple of, she was fairly well balanced overall, but she had this little niggling, a couple of little niggling issues going on, including an occasional.
I'm back.
And can you see us all now? Can you hear me?
Can you hear me, Christina? I'm getting. No.
Can you hear
nothing at
Jeff?
all.
All right.
Can you hear
well,
Jeff, Gail?
Christina, you'll
Nothing
have
at
to.
all. I can hear
you'll have
you loud and
Okay.
clear.
I don't know.
Actually,
See if Richard can fix it, because
Frank
they
is
can.
a really
Everybody
good
can
IT
see you.
person. Let's see what
I
she
can see
do.
you. You can
See,
see
it
me,
should-
but
I don't know
Might
how to
just-
get rid of that.
might
And then
just
sign.
right.
It's like, is it possible for Jeff to go off and on? Because we haven't got a way for me to get back to that screen.
I think that
Well,
may
that's all
stop.
Christina's.
No.
See, this. Oh, now let's try that. Is that going to do anything?
Yeah, if you plus.
Can you hear me now?
Still not doing
All
anything.
right. Well, Christina, let's go on with it.
Just check to make sure.
Right. Well,
Yeah,
I was
the
gonna
problem
say
is,
that
Jeff,
if
is
you
that can
just
heal
say,
your
'cause
Gail
Gail
talk.
can
Those
hear
are
you,
just
I
the
can't
people
talk.
that have signed on.
if you just tell her that I'm talking. Let me see if I.
I really don't know what to do. It doesn't seem to, unless I just go right out of Blab and come back in again. I wonder if I've got the link again. You know what, I'm going to just completely go out. I'll go and find the link and then try and come back in because I don't want to delay you any longer at all. Okay, I'll come back in a minute.
So.
Okay. Yep.
Yeah, just.
So
yeah,
this dog had a lot of little niggling things going on, including occasionally.
Again, hopefully Judy is still here. The limp was situational, so only if she overexerted or possibly injured herself, and it was transient. So it was not really anything that we focused on or were treating her for. She was being treated initially. Actually, she wasn't being treated. She was in such good overall health. So that was my question to you is, how you would approach, for example, a dog that does have a lameness problem that is intermittent, and that in this case, it's turning out that it looks like it's a cruciate ligament, at least partial rupture.
Well, I mean, I would consider if there was a transient lameness, I would be treating with homeopathy and any other modality. That's where I do use other modalities. If there's a symptom and it's a one-sided case and I've prescribed several times and I haven't made any progress, then I would try a different modality for a while. Or so I would take the transient lameness as serious, just like hairball vomiting. If it's even once a month, I consider that significant. If cat is drinking water and not on any of the early warning signs. So I'd be looking and I'd be doing my best to find that constitutional remedy, and assuming that any symptom can then progress certainly into something more. So I would be looking at more. Sometimes I also, with things like a transient lameness especially, I might palliate it with something like standard process or VetraScience supplements and see if it would go away with that. Not to continue that kind of palliation, but to see if it affects it at all. So I'll move into, I might have a chiropractor evaluate a lameness to see if they can pick up that it's really, sometimes a chiropractor will give me more information. So if there's a transient rear limb lameness and the chiropractor keeps picking up cervical problems, then that might change the remedy that I would use. Whereas by phone or relying on just a regular vet or the owner, we would have missed the cervical. So that's why I would do that. And also talking about ACL, I do have, if we move on and talk more about that, I've got some
I think,
suggestions
our
from
topic, Judy
on
was
ACLs.
gone, so she missed the whole discussion that we had about Lola. But I would love to hear what you mean as far as other modality suggestions, or just general suggestions about ACLs, exercises, physical therapy, underwater treadmills.
Right. Well,
Yep,
for ACL,
we did.
I'm gonna. Does this change? Can you still see me fine, or have I gone bye-bye? I'm still there. Okay. So standard process supplements and omegas were given to a dog that had minor ACL, and 1 year with no other treatment given, and 1 year later the dog was completely sound. One other person lasered a puppy that had 2 bad knees. They were completely blown, and the dog was fine 4 years, improved quickly, and then was fine 4 years later. Margot Roman would do prolozone. Whoops, sorry. Gotta move this up a little bit. Margot Roman would do prolozone injection. So that's using ozone to do what's called prolotherapy, which is injecting the joint which has it's a local treatment, and it has the tendons and ligaments improve, like thicken and become normal again. And she does acupuncture, chiropractic, and homeopathy. Steve Blake has 80% improvement with just homeopathy and no other treatments at all. So that was a brief little, I was going to do an article on ACL for the Integrative Veterinary Care Journal. And so that was the result. But of course, at this point where you actually have overt symptoms, I'd definitely be looking for the constitutional / even acute, maybe do a couple of acute remedies. I mean, that'd be my first approach, but those are other ones that obviously are giving good results. Now, you have to remember, if you choose to do a more temporary fix or a more local fix, like prolozone or prolotherapy, maybe even chiropractic, although that's not as local, that's pretty global. You want to really track all other symptoms. Don't just focus on the one you're working on, but you want to track all the symptoms so that then you can be fixing that underlying vital force imbalance that's causing the problem, even while you're temporarily fixing the problem, or even permanently fixing the problem.
Yeah, no.
Did you get the question on the drinking? I didn't get to read that.
Off
Did
the
you
arthritis topic, and I do want to get back to the ACLs and arthritis, especially since Susan just, if you remember last week, Susan presented the case of her dog who had the hypericum after possible injury and stopped jumping on the bed, the injury from jumping on the bed. And then she finished up by saying that the dog had pretty much stopped jumping on the bed altogether. And, we both suspected or wondered if there was something something energetic going on that we need to treat before the dog would start to jump on the bed again. But Susan just made a comment which applies equally well to ACLs and actually any lameness problem, as well as many other problems. That is that the small dog had gained 4 pounds. So the small dog had gotten to be a medium dog. So yeah, keep those
right. Gaining weight gain can certainly slow down jumping up onto the bed for sure. And the best way to lose weight, of course, is just like it is for a person. I need to be doing it now. Eat less, eat the right diet for you, and exercise more. And if that's not working, then finding the right homeopathic remedy. There is a rubric in the repertory for obesity. So that sometimes is needed to help animals or people lose weight, is to find the matching homeopathic remedy.
That we all have our genes. Everything nowadays is being blamed on the genes. We all have our own genes, but the way they express, the way they manifest is totally dependent on your lifestyle. The way you eat, the way you exercise, supplements, maybe homeopathy, definitely. And that's why the field of epigenetics, Big Al just landed right in the yard. The field of epigenetics, or how you can actually alter the genetic expression by lifestyle, and how homeopathy is great at doing that. Epigenetics is a very, very important field nowadays. Actually, I think it's gaining on the importance of what people say the importance of genetics is. So yeah, so there's a
especially if an animal like Lola is limited, and especially if an animal like Lola is limited in exercise for some reason, you have to
Lola gained 8 pounds from lack of exercise. Wow, and that's not going to help matters, Judy. So yeah, you probably gonna have to cut back her feedings even further. Make sure she's not getting any carbohydrate-rich foods, no treats, or use broccoli or other low-cal good veggies as treats. So.
Yep, remember carrots are high calorie. So even though we like carrots, and remember purple carrots are 50% or hundreds of times more nutritious than orange carrots. So if you are doing carrots, feed purple carrots. But that's one not to use when you're trying to lose weight. And it can be not necessarily lowering the total quantity, but it's feeding things that are lower calorie. So of course you want to stay away from, in addition to carrots, which have a lot of natural sugar in them, you would definitely want to stay away from any fruit because fruit has high calories. Maybe not watermelon. Watermelon might be okay. But I would limit the amount of fruit and stick much more with vegetables.
Yeah, I would imagine that whether it's fruit, vegetables, or any other food, that it's the total amount and number of calories that can have the greatest impact on the weight. But yeah, there's no question that the right homeopathic medicine given to your pet that's overweight, that's not losing weight, is going to help him lose weight. Because
now, as we know with people, and it's probably true with animals as well, is that different people, different foods have them gain weight. So there's some people who, to lose weight, they eat more carbohydrates. There's some people who would eat fruit and lose weight. So learning how to do muscle testing on something that's not a critical issue is often a good way to go. Learning to trust your intuition, finding ways to trust your intuition. And then you check it out, and if it works, then you trust your intuition more. If it doesn't then, if it doesn't work, then you sort of play around in less critical areas on that. But even blueberries have a lot of have fair amount of sugar
and it's interesting that you just brought up intuition well. And not feeding fruit. Last, or was it 2 weekends ago at the Medical Medium event, Anthony was talking about how fruit has gotten such a bad name, and we feed, we think we're eating healthily if we avoid the fruit, but things like wild blueberries and other fruits can really be indispensable. And at least in my allergic patients and patients that have skin problems, and certainly with joint issues, the kale plus blueberry mix that we use is very successful in providing a lot of palliative but nutritional relief.
Yep, yeah. Fruits are wonderful. It's just you just have to pay attention to the calories of them is all when you're working on weight loss. But oh yeah, all foods are good for some people. And some are more likely to be good for everybody, but not everything is. That's the
I would like
key to.
I was going to say I would like to talk further about arthritis and other joint issues, but before I forget, we should probably address Natalie's question about the adipsic dog. So we commonly will say that cats that are on a good fresh food diet don't drink at all. What about dogs?
Right. I expect healthy dogs to be drinking. However, there is a wide range of normal. And there are certainly very healthy dogs who stay hydrated on a wet diet, who do not need to be drinking. Now, that would be if you were taking the case homeopathically to have a dog who was on a wet diet, not drinking at all, would still be, I would put that in the thirstless category, even though I don't consider it necessarily an ill symptom, particularly if an animal had been drinking and then became ill and stopped drinking, then it would be very significant. But it could just be that that's normal. Puddle drinking, is there opportunity outside in the yard for a little bit of drinking? Because that might explain not the lack of thirst indoors. But I wouldn't worry too much about it. I would, the next time you see a veterinarian, especially an integrative veterinarian, I would have them carefully check for hydration and show you how to check for hydration, even very mild dehydration. And that way, you know, you'll be able to check occasionally and see if that's a problem. Nothing outdoors. So, you know, I wouldn't be worrying about it, but I would list it as one of the symptoms, as one of the idiosyncrasies. Wouldn't if that's the only thing,
Yeah.
you know, if there are no more of the early warning signs, then I wouldn't worry so much about it. So more on arthritis, Jeff. I pulled out the repertory, and just to let you know some of the symptoms that are in the human repertory that refer to arthritis. So this means it's a rubric. So we look it up in the repertory or index of symptoms. And if an animal has one of these symptoms, it then lists the remedies that are known in provings and in clinical practice to help with this symptom. So some of the ones that I looked up, one is arthritic nodosities. And that's where when you have a joint, especially a hip, and it's been arthritic and there've been proliferation, sometimes it'll break off and there'll be a little piece of bone floating around in the joint, which makes it very, very painful. So that's a dog who's had low-level lameness or maybe a slightly escalating lameness, and then one day all of a sudden can't walk at all. And that could happen in the knee as well, but it's much more likely in the hip. And that then makes it painful to walk. So that's one rubric, is arthritic nodosities. Another one that you often see with arthritis is you have the kind of arthritis that rather than being extra bone being produced, it's actually an erosion of the bone. And that's called caries of the bone. And we see that with femoral head necrosis. Raw celery is great. Just commenting on a side comment there. Then we have cracking. So that's when you go into that rubric, it would talk about cracking of the knee, cracking of the hip, that kind of thing. And then
well, of course.
Let's see. This is all in the extremities section. And another is exostosis, which is where the bone hasn't broken off yet, but it's producing extra bone, like in spondylosis, where the vertebrae are inflamed and rubbing against each other, producing a whole new vertebrae almost underneath the bone, which causes arthritis-type symptoms of problems with moving. And then there's a rubric, hip joint disease.
All these are great and very useful
rubrics,
Jeff? But I think everyone should realize that these are all really clinical and structural and physical, rubrics that we use to help narrow down the general picture. I think more as important or more important in some cases are how the arthritic symptoms are being affected, by the environment, whether it is better or worse by cool weather, damp weather, warm weather, going in, going out. And I think it's, again, very important to everyone to realize that these modalities are the very best way to understand what's going on in your animals' bodies. And that brings us again back to epigenetics. You can have two dogs that both have the same hip dysplasia or ACL or other leg problems, and yet one manifests symptoms and one does not. And that is due to the epigenetic effects on the transcription of the genes of each individual. And I think that, Christina, when you go back to the repertory, I'd love to hear some of the modality symptoms, some of the things that maybe people with arthritic animals should we be looking for that we can find in the repertoire? Because
if we go to stiffness, we have a lot of modalities under stiffness, and that is regardless of what joint is stiff, or the whole, or what leg or arm is stiff. And we have stiffness in the morning, stiffness after rising, stiffness on waking. So it's interesting, you'd think, well, that's all the same thing, morning, rising, waking, but it's not exactly the same thing. So you have to pay very close attention. Do they start sort of groaning while they're still in bed? Is it all during the morning? Is it after they get up, but then it sort of goes away? So that would help you narrow those down. Times a day that the stiffness is worse. Open air, is it worse when they go outside, or is it worse when they come back inside? In cold air. After exertion, or on beginning to move. So there's a place where we make a distinction with the modalities. Is it just at the beginning when they first start to move, or is it farther down the line as they continue to move? Or is it only after extensive movement? It's not listed here as a rubric, but that's something. They're walking, they do fine, and then after too much exercise, then all of a sudden it gets worse. A warm stove. Let's see what else we have here. Of course, there are many in the human book that don't apply. But stretching out the arm would be. So if you notice that there's soreness in the shoulder, and it only happens when you're stretching out the arm, or maybe they go to yawn and they stretch out the arm, and all of a sudden it's painful. You know, they flinch at that point. On beginning, well, we did that one. And while walking, that's neither at the beginning or at the end,
so
but
I
just
think
in general,
it
only happens when they're walking.
We need to be
So-
good observers. We need to see what modifies, make things better, make things worse, because, you know, I'm going to ask that, you're going to ask that, and so many clients do not remember, you know, the answer to those questions. So that, once again, just emphasizes the extreme importance of keeping a journal. Write down those modifications. It's a beautiful day out here right now, but all of a sudden when the clouds come in, you know, I get depressed and my joints ache, and, you know, I should write that down, because, you know, we have rubrics that say, you know, cloudy days, you know, affect certain individuals, and that points to certain homeopathic medicines. And if you didn't write it down, you wouldn't necessarily remember that. So yeah.
Yes, writing it down is so important. People just really don't realize that.
Well,
Okay, did you want to talk more about arthritis, Jeff? Can you think of some cases that you've had of ACL or of arthritis that
the
you've
majority
treated
of them actually do respond beautifully.
And how they've responded.
And of course, these are the pets that tend to be in better shape. Often they're smaller in size. The one that I'm thinking about right now was a lab, but it was a smaller lab that came up acutely lame. There were a couple of great modalities that we were able to find for the dog. So actually, the majority of the consultation was not about the dog's lameness, but about, you know, just the dog in general. The homeopathic medicine had to be repeated several times. But with repetition and over the course of, I think it was about 6 to 8 weeks, She was totally fine, never came off blame again. And I think, again, that just accentuates the importance of the individual, because that individual responded beautifully to the homeopathic medicine chosen based on modalities. But in some cases, there are no modalities that we can find. There are no modifications that we can find. Dr. Hussein was recently talking about a case like that in people, and they actually will sometimes use rue tincture. Rue, R-U-E, which is a tincture that is used to make up ruta. And I guess yep.
Mm-hmm. The homeopathic remedy, rutagraveolens. So I've treated a number of cases for ACL, and I remember one where the owner was fairly new to homeopathy and being pushed a bit by the surgeons to do surgery. And I called the surgeons and had a conversation with them about how long they felt comfortable waiting. And they said, as long as you're using some joint supplements, and this is maybe 10, 15 years ago. So I thought that was rather good. And this was a surgeon specialist. He said, as long as you're using joint supplements like glucosamine, chondroitin sulfate, that type of supplements, he feels that you have up to 3 months before surgery has to be done. So that gives you a long time that you're able to, that gives you plenty of time to see if they're going to respond to homeopathy or not. I would say that between homeopathy, chiropractic, acupuncture, 80% of dogs would not need the surgery. The ones I've treated, of course, have been all with homeopathy for the ACL. And I've treated some big ones, 80 pound, 100 pound. Some of them were slowly progressive. Most of them were from an injury, from a twisting. And the thing that we have to remember is that conventionally, we blame it on an injury. We blame it on the twisting. We blame it on the jumping down wrong or jumping up wrong or chasing a frisbee in the air. But really what it is there's already a weakness in the animal that then predisposes it to have that kind of an injury. So that's why the more we can work at keeping them healthy, as all of you are doing such a good job doing, when something happens, it's not like to make us feel bad. Whoops, we did a bad job. It's just, wow, obviously we missed something along the line that we didn't know about. So the ones I've treated, I remember one that was mostly Calcarea carbonicum, and I think I had to treat the dog for a good 8 or 9 months, might have even been a year and a half. And it was an older dog. It was about a 9-year-old big breed dog. So that took a lot longer for the dog to respond. Now, he was much better and was walking fine within a few weeks, but he still had recurrent lameness for up to a year and a half. Then he cleared up and was fine for the next 2 or 3 years of his life with no other problems. So it can take longer to respond, especially in older animals. But more, it's just not finding the right remedy. When we find the right remedy, regardless of age, there's a very quick turnaround. So I think I've had more 40-pound and up dogs with ACL than I have any smaller ones. I have treated another knee joint disease that there is luxating patella, which you can see in cats as well as in small dogs, usually small dogs, not big ones. And it's where the kneecap is slipping out of its groove. It has a groove that it sits in. And genetically or epigenetically, there's a lowering of the groove on one side or the other, so it flips out. I remember this one small miniature poodle who walked about 30 minutes a day, and the wonderful, wonderful guardian was counting the number of times the knee would pop out, and it was like started out at 120. So it was like every minute, this thing was every 30 seconds, the knee was popping out. And with homeopathic treatment, there were no other symptoms at all. And that dog actually responded very well to gelsemium, which is the only remedy listed in that rubric for luxating patella. or one of few remedies that's listed. And so I've, definitely luxating patellas, I've also been able to treat really, really well.
And depending on the
Lola could at
role, a
least walk
little bit
across
of
the
a limp
stage.
may not
That
be
shouldn't
enough.
be a problem.
A little bit of a limp may not be a problem. So yeah.
That's right. That may be good in a Shakespearean play. While we're on Shakespeare, I always have to put in these little extra tidbits. If anyone goes to visit London, be sure you go to the Globe Theatre. It is amazing. 2 trees were given by the Queen from the Royal Forest to help build the Globe Theatre, and both of them were growing during Shakespeare's Day. So well worth a visit. Okay,
well, hips
so that's
funny
2. What about
because
hips? How many hips
they
have you treated,
respond,
Jeff?
dogs with hip problems. I find dogs and cats, because there are a lot of kitties that we're finding with hip dysplasia, especially Maine Coon cats. They seem to respond beautifully. And again, I think that goes back to what they taught us, in the 70s and before in vet school, that there is no correlation between the way a hip looks on x-ray. So the diagnosis of hip dysplasia really is no direct correlation between the way the hip looks and how the animal acts to the hip. In other words, really severe case of hip dysplasia on x-ray may be present in a dog that doesn't have any symptoms of hip problems. But conversely, you may have a dog that seems to be crippled from hip problems, and the x-rays only show minor little hip disease. And of course, the difference between the two is not necessarily in the structure, but rather the way their body is responding to the disability or the health challenge. So yeah, I find that dogs with hip problems do great. Well, I don't know.
Now, have you actually seen? I've seen one case that I can remember where we had good X-rays before and after, where so here's the head of the femur sitting the normal way to sit into the hip socket. The acetabulum is like this. So the hip is really surrounded by the acetabulum and held in place. Of course, there's tendons and ligaments as well. And this hip looked like this. It was like practically flat. I mean, there was no working of it at all. And after homeopathic treatment, it got back to about this. So the hip stayed flat, or the head of the femur stayed flat, but the hip pretty much remodeled and it sunk into place so it actually could rotate normally. So I definitely saw that was a brilliant one because I had good follow-up on that. So have you seen any like that, Jeff, where you've actually seen remodeling of the hip socket?
X-rays on the dogs that are improving. The closest things that I've got in my practice are, for example, Lucy, who was crippled with arthritis, and the X-ray showed horrible hip dysplasia 7-8 years ago, and with treatment, she's had no hip problems whatsoever, and her people just don't want to go and get follow-up X-rays because they are so happy with the way that Lucy's been doing. So yeah, no, I don't. But
right. It's good to ask people if they're willing to, because it could really, that can make a difference when you show a very questioning veterinarian pre and post x-rays. That means more to them than just the fact that the animal is walking better. So when we can do that, I think it is an important thing to say. And now
You've
I
gone into
don't
his
see
class?
Jeff anymore. Jeff has just disappeared. Jeff just, yeah. I see you, Gail, but I don't see Jeff. So Gail said that
We've seen all sorts of stuff,
so-
and sometimes
so you
we
have
don't have
seen
formal
some hip dysplasia,
diagnosis.
Gail,
So, you know,
in
we follow
cats.
our menu for healing for pretty much anything that comes across our path, and we change the diet gradually. We always, I mean, the very first thing we do with our animals, for the most part, as we're changing the diet, we're recruiting a homeopath. And those two things go hand in hand. Love, the immune support. Hemp is a great addition to our menu, and we really saw a completely across the board response when we started. And that was almost 2 years ago now, and we use it every day.
Oh,
pretty
good.
much for all the animals. It's been an amazing.
Wow. 2 years.
Well, we have
So are you
different ones.
using
We
Rob
use
Silver's
Canna Companion
THC,
in
or
Seattle.
which one are you using?
Canna Companion. Oh, okay.
You use which one? You might want to type it in for us. So Jeff, Gail was just talking about that they've been using hemp across the board with all of the animals, and feeling there's a really good improvement. Canna Companion.
You know, I really love Rob Silva RX Vitamins Hemp RX.
What we do, I'm sorry, Jeff, I didn't mean to interrupt you, but what we do actually, we use Canna Companion on a daily basis for the animals who actually will just take it very easily. It's in a powder form, and some of the cats don't particularly necessarily like it. We actually formulate it with our immune mix and lots of colostrum, so it tastes good. So most of them will either drink it or take it by syringe. But when we're getting closer to the end of life, when animals don't necessarily want to take stuff that way, we always use RX hemp because it's so much easier to work with, very much easier to work with.
Yeah,
Interesting. Hemp was helping me for a while, but it didn't seem to dig in and do very much. So I was traveling, so I stopped it, and I haven't started it back up again. I'll probably start it back up again. I'm actually this is good because I'm suffering from bone-on-bone hips on both sides and stenosis in my back. And yet what causes the pain isn't the hip. It's not the joint that's causing pain. It's all the tendons and ligaments around it. And those are so much, should be able to be relieved much more easily than the bone itself. And I've tried, there goes Jeff again. I've tried multiple things. And in homeopathy, we talk about how if you have a chronic disease, and then you get an acute disease that's stronger than that chronic disease, it shifts the pattern. So you're now in a new pattern, but that old one is still simmering down there. And when the new disease goes away, the old one comes back unchanged. And I've had exactly that happen. So I have my chronic hip disease, mobility disease, and then I got a really bad cold, which I don't usually get. And while I had the cold, I was walking and jumping, and I wasn't totally normal, but I was 50% better. And now as the cold's gotten worse, or gotten better, and the cold's gone away, the mobility has gotten worse again, so it's come back. So I've got a beautiful example of how symptoms can come and go, and learning the principles of homeopathy really give you a way to understand what's happening. So that was a good example, and I'm, like I said,
I would try different products.
So I may go back to it now
that
the symptoms are returning.
You'll work a little bit differently, I find.
and I see Becca just joined us from down at the restaurant in Florida, and I know they're doing a lot of great study in homeopathy. And you brought up one of the most important things, one of the most important aspects of Hahnemann's writings that I think is being overlooked by a lot of people, and those are what you have seen with your colds and joint pain, and that is the dissimilar disease. That is more than one disease living in the body at a time, and just the stronger one displacing, for the time being, the weaker one. And when it comes to treatment of individuals, everyone likes to use the peeling the layers of an onion metaphor that you do it little by little, but actually, the way I understand it, you're addressing what, like you do with your little picture there, your little hand picture. You're addressing one little piece of the energy with one remedy, another here. So you're whittling away. It's great if you can find one big overall constitutional quote-unquote remedy that addresses everything. But frequently, as with your cold alternating with hip pain and joint pain, frequently you have to treat the individual symptoms as they come up, and over the length of time, the constitutional imbalance will improve.
Although I think alternating wouldn't be accurate because it was not really alternating. It was one cold. And so I think that's more the dissimilar symptoms. It's not like cold hip, cold hip, cold hip. So that's more. Now, is Rebecca, right, are they seeing down at Wings of, let's see, it's on the Wings of Angels, right? Are they seeing much in the way of physical problems that you've been treating, or has it been mostly behavioral problems?
Wrong, but I'd say 2/3 to 3/4 are physical problems. Actually, yeah. Right now we've got a couple of dogs with, tumors, and I hesitate to say cancer because they're really just, tumors, growths, or abnormal swellings. A number with kidney diseases that we're treating. Many have, skin problems. This is Florida after all. So, the hot, humid weather exacerbates a lot of these conditions. So yeah, it's a combination of both. And like Becca just said, I think the majority are physical, but there are some big emotional cases as well. I mean, I'm thinking about Max. Becca is working with the dog right now. That was, just so hard to handle. Actually, I think impossible to handle. I don't think he was even walked. I think that nobody was able to interact with him until he started with homeopathic treatment. And now he's making great strides. Yep. And like Becca
and he's
said,
making great strides.
We'll be updating tomorrow. As far as a bunch of the other dogs there. But yeah, just the what I want to get back to with the dissimilar diseases, I got off track a little bit, is that it's homeopathy and Hahnemann provided a scientific framework for healing of the body. So it's not like modern medicine is kind of hit or miss. Well, we'll try this, we'll try that. This has side effect. Well, maybe it's good for treating something else. That's pretty much, there are no rules to the game. Granted, physiologically, we're trying to match drugs to disease processes, but frequently not successfully. Homeopathically, though, there is a scientific framework. There is a framework that guides the decision about what you do and when you do it, or what you don't do and when you wait and watch. I think that's what attracted a lot of us. And a lot of the best MDs were becoming homeopaths back in the 1800s for just that reason, because medicine back then had absolutely it was really all over the place. That's why Hahnemann named it allopathic versus the homeopathic. Allopathic meaning just that it's all over, right? What is you're the
Well, actually, I think they had a very, in Hahnemann's day, they actually had a very consistent approach. Their idea was that there was something bad inside you and they needed to get rid of the bad. Regardless of what the disease was, they had to get the bad out. And therefore, they gave you mercury to make you sweat and have diarrhea, arsenic to vomit and diarrhea. They bled you to get the bad thing out of you. And today, our perspective is stop the symptomology. So our goal today is to stop symptoms, and that's why 90% of our drugs are antis. And so I think in the 1900, it was probably shifting from get the bad out to stop the symptoms, and it was a little bit of both at that point. But it certainly was hurting people, and that was what Hahnemann said, I can't do a medicine that makes people so much sicker. And that was even why Hahnemann, after seeing the huge benefits of homeopathy, curing gout, curing infertility, curing cancer, curing arthritis, even after seeing that people who'd been ill for 20 years were getting better, he said, this still isn't good because they're getting very, very, very sick first. They're almost dying over the next month after treatment, even though eventually they're cured. I don't like that. So let me make this medicine more gentle. And that's when he came up with the dilution. He diluted it. And to see if rather than giving straight arsenic, if he diluted the arsenic, maybe it would still work and wouldn't cause the horrendous aggravations he was getting, and that worked. And so that's why we have our system of medicine of homeopathy today.
Don't realize that homeopathy is not the same as dilution. That the dilution point came in later, and that actually originally Hahnemann was using low potency, sometimes just the actual tincture from the plant, because the important thing is not the dilution. The important thing is the matching likes with likes, which is the essence of homeopathy, that likes cure likes. I'm just trying.
Or homeo, like, or similar, pathy, disease. So like the disease, similar to the disease.
I just want to see if
what else did you want to do on arthritis? Anything?
And we'll get to, because you mentioned that you mentioned that you had some other cases or experience with other modalities for arthritis that I would certainly love to hear about. I'm just putting the link in there to the article, for the blog article, that dilution is not the same as homeopathy. So yeah, let's get back to arthritis. I put in a few tidbits earlier on from the article on just natural arthritis treatments, and I'll keep doing that. But Christina, do you have any experience? Because this is something that I think Judy would be very, very useful for Lola. Do you have any experience with the underwater treadmill, and then PT for arthritis?
Well, the IBC Journal has done a number of articles on mobility work, different physical therapy approaches, different positioning, posturing kinds of things. I would, while those are good, in addition to the homeopathy, the first thing I'd probably do is Reiki. I would be sure, Judy, that you're offering Reiki every day. The second thing I would do is Tellington T-Touch, because Tellington T-Touch really helps the nervous system and the muscle, tendon, ligament system work together. And so I would think that would be very important. And I'm sure there's some YouTubes about different Tellington Touch approaches. T-touch is not merely doing the 1 3/4 circles on the skin, moving the skin over the subcutis. That's part of it. But they also have movement exercises that go with Tellington Touch. And so you may want to see if there's a Tellington Touch, a T-touch expert in your area, because that could really help. When you're looking at doing, see, my concern with Lola is she said after 5 minutes of swimming, Lola was not doing well. So I would be much more, I wouldn't be jumping right away to either swimming or the underwater treadmill because of that. I'd make sure there was some improvement first and then try that. I have seen great response with that. We have a place called VOSM, Veterinary Orthopedic Sports Medicine, and people fly in from around the world to have their dogs treated. It's located very near the Baltimore Washington Airport, and it's the best clinic I have personally ever seen. It's an orthopedic clinic, and their floors are padded, so the animals are comfortable. They don't have exam tables. It's all done on the floor. They've really thought about things like braces and other approaches. And so you want to go to somebody who's good with the underwater treadmill. And I've seen them doing it there, and they're very careful, they're very cautious, and they know what they're doing. So if there is somebody who's as good as them, who's really good near you, then that would be a good thing to do. Now, when we're looking at acupuncture, treating and seeing good success with acupuncture for something like a lameness, hip problems, knees, anything like that, the piece you have to remember, whether you're going to an acupuncturist, whether you're going to a homeopath, whether you're doing chiropractic, osteopathic, whatever, is every single one of them can help. And I have seen dogs be completely normal with acupuncture. The problem with acupuncture, number one, is that often it needs to be repeated frequently, so it makes it difficult for animals who can't travel. Often in a few treatments, they are, like you're saying, that your dog went from no mobility to excellent mobility in 1 month. And I do see this frequently with acupuncture. The piece I want to add in is you're going to be the one responsible, particularly going to Steinberg at the barn. I don't know that they're looking yet at the whole animal. So I want you to be looking at the early warning signs of illness and any other symptoms that are ever there in the past, and make sure that you're building health, that you're getting that underlying energy field fixed, not just fixing the hip problems. Acupuncture can do that. Absolutely, they can have a cure, but not all of them focus on doing that. So you need to be the one that makes sure that everything gets treated. Too often with acupuncture, they'll tend to focus on one symptom, even though they still are treating the whole animal. They're doing a good acupuncture job, but their focus may be a little too much on one. Now, other acupuncturists are treating the whole animal, just the way we do with homeopathy. So you may need to follow up with good homeopathy. You may find that doing the acupuncture will do it, but watch for things like little goop in the corner of the eyes, red line on the gum, any appetite or thirst problems, that kind of thing. You want to be doing both. She has lymphoma and IBS, so you do want all of that to be. What I'd recommend you do is, if you go to my website, we are going to be having the Dalmatian Club of Washington, D.C. is going to be hosting an introduction to animal homeopathy in Lexington Park, Maryland. And if you go to my website from the home page, you can link to the page. And what you will learn by taking that weekend course, to Friday night, Saturday, and Sunday, it's the end of September, beginning of October, you will learn how to understand the lymphoma, the IBS, the ACL, or whatever it was called, whether it was hips, the vomiting afterwards. So you're going to be able to understand how these symptoms relate to each other. That's what would be the most important takeaway from you from taking the course. That would be really important to understand the process. That's one thing Gail got really good at over the years of using homeopathy, is understanding the process. When do I worry that we're going the wrong direction? When do I realize that these symptoms are indicating we're moving in the right direction? Which symptoms are more severe or less severe? That type of approach. So definitely it's good that they're treating you for everything there, your dog for everything there. That's wonderful with the acupuncture. So just make sure you're staying on top of is everything getting better.
Wind down today,
that's
that I think is a great take home, that we need to, no matter how we're treating, we need to be treating the whole individual. The goal is not to get rid of a problem per se. The goal is to increase the level of health of the individual in such a way that that individual problem and other problems that you may or may not be aware of go away. So focus on the whole. Don't just put needles in one area because, or have the acupuncturist put needles in one area because there's a problem in that area in particular. And just focus on the whole. Go for the gusto. Long, happy, healthy life overall. So, Gail, are you actually hearing me still?
Yep, I'm hearing you.
Oh, okay, great. Oh, that was weird. Yeah, it was. Anyway, so we're going to wind down for today. Is there anything else? Actually, the chat's going to be open for a few more minutes. If anyone has any questions, you can just put them in the chat. And have a great week. Do you have any big plans coming up, Christina and Gail?
No, I'm dealing with a boy who's in his dying process, so I'm going nowhere. I'm a homebody.
Yeah. Well, hopefully I'll see you both next week, and we'll talk further about, Thursdays on Blab. Right. Thank you all for coming. Bye-bye.
All right. Bye-bye, everybody.